I'm Dr. Steve Myers, and I'm here with my patient Diane, and we're going to talk to her about her stem cell procedure. She just had bilateral stem cell injections in her knees about 2 months ago, and we're going to see how she's doing. Before we talk to Diane, I'm going to take a quick look at her x-rays. This is a standing x-ray of both of her knees. This is the less symptomatic right knee and the more symptomatic left knee. Looking at her right knee x-ray, you can see good dark space between the bones. That is the cartilage thickness in the knee. But on the inside of the right knee, there's significant loss of the cartilage thickness with big bone spurs here and here and here and here as well. That is part of arthritis, the loss of joint space and bone spurs. Looking at the more symptomatic left knee, you can see good joint space on the outside of the knee, but significant loss of joint space and cartilage on the inside with bone spurs on both sides of both portions of the left knee joint. So, thinking back to before this procedure in October, how were the knees? The left knee's always been the bad knee, correct?
Yes.
So what kind of trouble were you having? What kind of difficulties were you having with your left knee? Describe your symptoms before the procedure.
The problem I was having with my left knee was that it would be really stiff. It was hard to get up in the morning. It would just hurt all the time. And so I decided that it was time to do something about it.
Have you been limping with it?
I have been limping, yes.
Pain getting up from a chair?
Yes.
Negotiating stairs?
Yes. It
Okay.
was hard, all of those.
And so let's go back to the day of the procedure, getting the cells, doing the injections in the knees. How bad was the pain getting the cells in the injection? How much pain was that?
For me, the pain wasn't bad at all. I mean, I laid up there with my head on the pillow, and when you said it was over, it was over.
Okay.
And I said, well, are we finna start yet?
Good.
And so it wasn't that bad at all.
So here we are 2 months from procedure. How are you doing?
I'm doing great. I'm doing great. I can work out on my form. I don't get as tired. I mean, before I had to stop because my knee would hurt so bad, and at night I would not be able to sleep very well. But now I sleep just fine. I mean, everything is good.
Are there activities that are a lot easier now than that you were having difficulty doing before back in October?
All my activities are better. I mean, they're all better. I mean, I can walk upstairs. I can kind of get out the chair without hurting. I can get in the bed without hurting. So walking is great. I mean, everything is better.
So now 2 months after procedure, looking back, do you feel like you made the right decision? Would you do it again?
Yes, I made the right decision. Absolutely, I made the right decision. I would suggest it for anybody before surgery. I mean, that's the reason I did it in the first place.
Okay, awesome. Well, thank you so much for coming in, and I'm so glad to hear that you're doing so well.